as most people feel with their pet, I'm just go ahead and give it whatever it wants. And I think right away you need to discipline your pet. They need to earn things instead of just putting the bowl of food on the ground.
Yeah, my dog just ate a grape. Is it ER time or can I wait?
This is what makes it more challenging. It will cause kidney disease or failure. It affects the kidney.
Okay.
That's what the grape will do. Most insurance at this point will not cover, let's say if your dog suffered a knee injury, we see a lot of tear ligaments. If the dog has already had a tear and you don't have insurance, the insurance is not going to cover it.
Oh, my cat hasn't eaten in 36 hours. Is that a crisis? There was one moment where it touched my heart. I just saw this older lady was carrying this puppy and holding him around, and the puppy just wouldn't stop licking her. It looks like she was having the time of her life.
Yep.
It was the happiest that she's been. Well, welcome back to episode 4 of Language of Pets. I'm your host, Calvin, and right next to me again is Dr. Dan Lange. If you don't know it already, he's been a vet for 44
years and 13 days or something. But who, as the saying goes,
who's counting?
Keeping track.
Right? Yeah. Well, I counted because the first episode I titled it "What 16,000 hours taking care of animals have taught you." Something
That's
like
good.
that.
I like
so
that.
I did a little bit of.
Well, that's a lot of hours.
I did a little bit of creative thinking in the title for that, because at first I was gonna be let's just put 44 years, but I think if we fluff up the number,
thank you, Calvin,
that might attract a little bit more of an audience. But yeah, this is episode 4. Today we're going to talk about symptoms of that you would come across with your pets, and how to differentiate when it is something that you can just monitor versus when you need to rush them to the hospital.
Yep.
But yeah, just to catch up on it, I know in our last episode you were talking about having a trip planned out to go up and down the Mississippi River.
Yep.
That is coming up soon, or that's still in the works,
Well, it's still
right?
up in the air because we have to talk to the lady that takes care of the animals, make sure it's compatible with her schedule. It gets very, very complicated.
Yeah. Yeah, I bet.
But I'm hoping my goal is as small as the
How
least.
many children do you have here in the farm? Plenty. Any other big plans? Because that sounds like a pretty big plan to have. Any weekend trips or anything like that?
Yeah, we kind of talked. I think at first my wife had mentioned, I'm not sure which river was. I think there was a Missouri River cruise just for the day or part of the day.
Okay.
She didn't mention the river. I thought she was talking about the Mississippi, and I was getting all excited. Finally, we're on the same page. We're together. And then she said, well, this would be for the afternoon. And I'm thinking, that's
not possible, right? That's too short of a trip. And departing in midday. Okay, so Missouri River is shorter than Mississippi, right? Or narrower?
Let's see. Boy, that's a great question. I'll have to...
Obviously, because the trip is shorter. I was just assuming there's not as much
Probably
to see.
not as much as the Missouri River. Well, maybe Lewis and Clark did. I'd say how much the river is navigable.
Mm-hmm. Maybe I can look it up really quick.
Either you look it up or that'll be my homework assignment.
River is larger.
I don't think the channel isn't deep in most places, so probably there's going to have to be a smaller boat to carry it through.
Well, ChatGPT says Mississippi is larger overall. Well, there you go.
There we go. We got it.
Yeah, but not by much. It doesn't look. Oh, well, length is only about a mile longer.
Wow.
Which is interesting.
Yeah.
But higher discharge, so higher volume of water flow.
Yep.
Interesting. Well, learn something new every day. So yeah, today we're going to be talking about, diagnosing your pets, self-diagnosing, and when to know to call the hospital or rush them to the hospital. First topic is are just overall, are there any obvious symptoms that are just don't wait, just rush them to the hospital?
Seizures are probably the most common emergency we see. That 8 out of 10 times a dog starts seizuring, and people rightfully so, because that's what you're supposed to do, bring the pet over. by the time they get to the animal clinic or animal hospital, in many cases, thankfully, the seizure has resolved.
Okay. So,
So
but
then the
would
dilemma
it,
is, well, do we do any testing to find out what caused the seizure? If it was the first time, do we just monitor the pet and send it home?
yeah, I was gonna say usually seizures wouldn't last that long, right? Of the car ride, at least to the
Right,
hospital.
right.
So, what kind of tests would you be able to do or diagnosis that you can do?
Well, most time we just do blood tests to see is there something in the body like a low blood sugar, a low calcium, a kidney problem, a liver problem that would affect the brain indirectly and cause the seizures.
Okay. Okay.
But nowadays, veterinary medicine has gotten sophisticated enough that we have a veterinary neurologist, and they have the means to do like a CAT scan or MRI or something of that sort. And because they do it more frequently, they often will do a spinal tap as well when the pet's sedated.
Okay.
That's just something us general practitioners don't do on a regular basis, so most of us are uncomfortable doing it. But they can do more invasive tests. Let's say if you have a 10-year-old seizuring dog, well, there's a reasonably good chance it could have a brain tumor or something, definitely medically speaking. The vast majority of seizure dogs are epileptic, but usually that's between a year to 5 years of age.
Okay.
It's usually younger.
Would having the dog still be in seizure whenever you see it be helpful, or is that something?
What you mean?
So like they were still having a seizure when
Well,
they
I think
bring
at the
them
animal hospital and they're having it, we have medications we give to the dog
Okay.
to stop the seizure.
Will it tell you a lot, or is it just like no?
It just, I mean, if the seizure goes on too long, potentially a dog could die from it like a person.
Sure. Okay.
And so you want to just.
But there's no indication of like, oh, it's because
Yeah.
of this. You'll have to run the tests to
Yeah.
find out.
And certain breeds, may have a disease that could cause a seizure. So maybe the genetics of the pet may help us a
Pinpoint
little
it.
bit. But it's
Gotcha.
more just taking care of the emergency and then deciding what kind of diagnostics do we do. Usually if it's just one seizure, I won't start putting them on seizure medication. But if they have more than 1 or 2 seizures a month, then we have to be more aggressive medicine-wise.
Okay.
But your original question, pets having a seizure, you don't want to mess around.
Okay.
Just get them in right away.
Then would that still be the same as? Would that be the same answer as what's the most common reason that pet owners are bringing?
Well, the most common probably is like vomiting, diarrhea.
Okay.
Maybe the pet stopped eating, or the pet's become more lethargic. If you have a small dog and it's vomiting, diarrhea, losing fluids quicker, it's going to become pretty dehydrated,
Okay.
and that'll cause weakness.
Yeah. Would they? Is it typical, like, because if it was me and I wouldn't know anything, like, first thing about diagnosing a pet. Any small sign or symptom that's not normal, I would take to the vet. So is that
That's
common
the best
then?
thing. Or I tell people, you'll call. I mean, our receptionists are very well educated.
Okay.
Or if they don't have the answer, they'll grab one of us, and we'll
Yeah.
help the client make a decision
Whether to bring them
whether
in or
to
not.
come in or not. So don't
Okay.
don't hesitate to call. But if you're just, and rightfully so, if you're in the panic stage, just bring the pet over. And
Yeah.
and some say, well, later, why did I do that? But you do what you think is right at the time.
Of course. Okay. So then it's not.
So
So
ask
I'm
for some
not
help.
wrong
I'm
in
trying to
thinking
answer
of
your
that.
good question.
Yeah.
If you're not sure, call first.
Call first.
And see if that truly is
Okay.
needed. But again, the seizure, as an example, is something you don't call. You just maybe call to let us know you're coming, so we're
Yeah.
ready for you.
Yeah.
But
Yeah.
you're not calling to see if should I break the pet in or not.
Yeah. Okay. Then if that's the case, then what would be a case that they would bring to the emergency room but isn't actually critical or anything big at all?
Well, most time the vomiting and diarrhea is not a critical.
Not a critical
So
thing.
just to kind of use the same
Yeah.
example, but of course you'd be more concerned if the pet's not eating at all, or let's say it's really subdued, then that would indicate getting dehydrated, losing our electrolytes. The large breed dogs, like a Great Dane, they're prone to a flipped stomach, twisted stomach, and that is life-threatening if you don't get that taken care of. So if you have a deep-chested dog, you don't want to mess around for the most part.
What would typically cause that to happen? Is it just
Well, one
natural
of
way
the topics I
life?
was thinking about doing down the road is that there are a number of diseases, conditions, we don't know what causes it.
Okay.
And again, I was vet school 45 years ago, 50 years ago, and even then and now, there really is no more new information what causes a flipped stomach, twisted stomach.
Okay. So there's not anything like any sort of massage or any chiropractic
Well, they're claiming now that,
solutions?
and I have to tell a funny story, that if you have like a Great Dane, let's say you feed it, maybe you wait 30 minutes to an hour before you let it out to run around, that there's been some speculation if the stomach is full of food and you go out there and the movement of the dog may cause the stomach to flip.
Okay.
So there's certain things, and at one time there were certain dog foods that they claimed you were less likely to have a stomach torsion, flipped stomach, if you ate this food, but unfortunately they went to court because it wasn't a help, the type of food.
Okay. So then there's definitely there's not really a sure way to prevent these type of.
Well, yes, there is. Thank you.
There is?
It just if I have a Great Dane, as an example, coming in to be spayed or neutered, with a spay, of course, we already are making an incision in the abdomen, and what we will do is we will recommend highly, if the pet's already anesthetized, we can tack the stomach to the side of the the side of the abdomen,
Okay.
so it will not flip. Once this happens, it may fill with gas and air, but it will not twist, and the twisting is what's the life-threatening
Gotcha.
part of it.
Okay.
So as a prevention, if you have a breed that may be predisposed, talk to your doctor and think about having this, what we call a gastroplexy, that we actually make a slight incision in the stomach, and then we take that tissue and suture it to the inside the peritoneum, the inside lining of the abdomen, and that will prevent it from flipping. So that's the best thing you can do.
Is that a procedure that it's not invasive or is not
It's
life-threatening?
invasive because you have to go in the abdomen.
Well,
But again, if you're doing a spay,
Yeah.
you're already inside the abdomen. Why not do it? Of course, the male, we just make a skin incision in the scrotum to remove the testicles.
Okay.
But my thinking is, if it's predisposed, it's already sedated, yes, we have to make another incision. But it's invasive, but the pet is perfectly healthy. Often a lot of dogs die because they're in shock when they're in the flipped stomach, and we do surgery to decide to save the pet. And in many cases, the pet, not many, but a lot, the pet is in such bad shape that it will die.
Okay. I think what I meant was, is that a procedure that would be in addition to something that you're already doing, or would that be common? It would be a common procedure to do on its own. Like
It's the best way to prevent these flipped stomachs.
Okay, so it can be done on its own as a elective procedure.
Yep, I didn't say it very well, but it is definitely an elective, highly recommended.
Okay, gotcha.
Yes.
All right.
I didn't state it very well, so good comment.
Yeah. Is there one thing that looks mild but secretly it is very serious? Any symptoms?
What comes to mind is we have a lot of dogs that develop anemia, and often it's a very gradual thing, so people don't think too much about it, but then they think about it when the pet has gotten so anemic that it's not eating, not moving, or getting around very well. And if you would lift up the gum, and I try to tell people it's hard to be objective when it's your own pet, but if you lift up the gum, normally it's pink, and if it's white, your pet is losing blood or is becoming very, very anemic. Again, they may just be more subdued. There's nothing obvious, vomiting, diarrhea, seizures, but something of that sort. Or the other one is where some animals become jaundiced, they turn yellow, and if you look at the white part of the eye, you'll see the yellow, and then you don't want to mess around. You want to get your pet in right away.
Okay.
But often they're very subtle clinical signs.
Okay.
So that might be an example.
And you've mentioned before that they're very good at hiding those symptoms, right?
That's the challenge.
So is there, what would you say are certain daily routines that pet owners should be doing to help catch these?
Well, one thing is, especially more for overweight animals, I like pet owners to try to weigh their pet once a month.
Okay.
Because many times they say, well, I'll just look at the pet and see if it loses weight or if it's putting on more weight or if we're not making any head weigh. But until they lose 4, 5, 6 pounds, you're not going to know. Just like people, let's be more objective. Get a body weight. If a pet is gradually losing weight and eating fine, could have diabetes.
Okay.
If a pet's drinking excessive amounts of water, diabetes, kidney disease. And a lot of times people rationalize, well, the pet's, it's hot, pet's drinking more water. But if you have to get up in the middle of the night to take your pet out that's potty trained, take out to urinate, it's probably drinking too much water.
Okay.
Or cats, often you see, oh my God, look at all that urine in the litter box.
Yeah.
Cat's probably drinking too much, even though you may not notice that.
It's I would assume it's hard to kind of catch those changes because you're with the pet, every single day. And
I tell people, I understand life gets in the way, but how often do you check the litter box other than quickly trying to clean it? I mean, you got to get the kids to school, you got to get to work.
Yeah.
And so the pets, rightfully so, are a little lower on the list.
Yeah.
Or us husbands, we're probably not as good. Oh yeah, there's a lot of urine in the litter box, but it's my job to clean it, so you're not going to say anything to your wife or anything like that. So maybe men don't pick up, we do our job, but we don't pick up on subtle differences because they probably do more of the pet care, the ladies of the household in general.
Yeah, I get that a lot because I'm with my parents almost every other day, so they don't notice me, notice big changes. But oftentimes, whenever I see friends, in between a few months or so, they're like, "Man, you've gotten fat," or "Man,
exactly,
have you lost weight?" and all that stuff.
Exactly.
So, yeah, I guess it's difficult to.
It isn't nice to have an
changes.
outsider, but again, weight-wise to monitor, let's try to weigh the pets once a month. And so if there is a
some
change,
solid data,
it'd be much sooner able to change things than if you wait till. I've had some cats that have lost half their body weight and then they bring the pet in, and of course it's much more challenging. I once had a 20-pound cat, now it's 10 pounds. That means it's gone on for a long time and you've lost half your muscle mass, so that can be difficult.
And speaking of feeding, then because there's general criteria and guidelines on like how much to feed your pets.
Yep.
Would you say it's safe? Because every brand has their own recommended portions and all that.
Yep.
Would you say that that's fairly accurate, or are they just trying to be on the safe side? What would you say is the
Well, my
good
cynicism is part of it, they're trying to sell more dog food. But more recently, I've read, and I don't know why the companies do this, but to determine how much food is appropriate for your dog or cat, they, especially dogs, do this on performance dogs. Now, these are dogs that are running around or do agility.
Yeah.
They get a lot of exercise.
Yeah.
But most of our dogs and cats are suburban pets. They get lucky if they get a couple walks a week because, again, people are busy.
Yep.
And so, those our suburban animals don't need that much food.
Okay. So what would you say is like I know this is hard to kind of pinpoint, but like a good portion of food for their diet?
Well, I think most cats would take a cup of dry food a day.
Okay.
And, if you're up to 20 pounds, then the dog, maybe the same. A middle-sized dog, maybe a cup twice a day. A large dog, maybe 2 cups twice a day.
Okay. Then my next question would be dry food versus wet food. What's better?
Well, for many years on wet foods, we felt like it made the teeth work. It added more tartar debris onto the teeth. And so the dry food being crunchy is probably better.
Probably better.
And most people don't like to mess, the canned food sometimes smells a little bit.
Yeah.
So a lot of people don't like to mess with it.
Yeah.
But I'm a firm advocate with cats. In general, I would have cats eat a good 50 to more % of their diet is canned food.
Canned food.
They don't drink enough water, and a lot of them are overweight because at least you can take your dog for a walk if you have the time. But cats in general don't get enough exercise. Canned food is 80% water, so there's a lot less calories. Dry food is very high calorie intake.
Yeah.
So with a cat in general, I would lean more to the wet food.
Okay.
And in general, more dry food for the dogs.
Oh, okay.
And people
I
have it
would
all
think.
backwards. When I tell them on their cat give canned food, they think, well, isn't there more calories? I don't know why. Maybe one time I thought the same thing, but it's like the doctor tells you and I, if you need to drink more water or help lose weight, the water will fill you up. Drink more soup or fruits and vegetables because there's more water in there. And it's the same with the canned food. Since it's 80% water, hopefully the cat will be less
looking at you with those big brown eyes, wanting more food.
Yeah.
If it's filled up with the water or the canned food.
I think your feline friend kind of heard you
Checking out the
talking about
joint.
him. Yeah.
Should I get petted by Dad or what? That's Lizzie.
Lizzie.
She
okay.
was named after a Catholic nun. The way I hear the story, I never met the nun, but she didn't have the best reputation.
Susie named her, right?
So Susie did. Susie was raised more Catholic than I was, and apparently was not. It's kind of a negative name. Now Lizzie and I are kind of buddies.
Yeah.
So I still call her Lizzie, but Lizzie doesn't know that that's a bad thing. So
Okay.
we're all good.
Well, we didn't plan this, but it just so happened that Lizzie was walking around.
She's very curious.
Yeah. Awesome. Cool. There's a question that I had. So speaking on taking your pets to the hospital in case of an emergency, is there a typical list of kind of go-to items or things that pet owners should take with them when taking their pet to the hospital? Obviously, you got to have the pet with you, but is there like some sort of go bag list that they should have?
I'm not sure I know what you're saying, Kelvin. Are you talking like a history of what medicines it's been on, or
Yeah, just anything
or
that
what they were seeing with the pet, or
anything that you would think it would be beneficial for the pet owners to have with them.
Well,
on the way?
nowadays with computers and everything, we usually have a pretty. If we dispense the medications, now supplements they may get online or at the pet store, but most of the time, if the people get the medications from us, we're pretty good.
Yeah.
Having that.
Okay.
Knowing what kind of food really helps a lot. But it's amazing how many people. Well, the dog food, it has a purple print on it. It's got some yellow, but they can't remember the name of it. And so I tease and tell. Advertisers or marketers, they're not doing a good job. You need to do some other way, and I'm teasing a little bit, to imprint the name, because people do forget. Of course, if it's the husband coming in, he doesn't know because mom, shopped for the food.
And each brand has their own total line of foods, and they have every single color to differentiate, right?
But I think some people think, well, if I tell you the color on the bag,
you would know. Yeah. Oh, it's the yellow bag.
New food comes out.
Yeah.
So maybe some of the common foods we may be able to help answer, but
okay. So just
a good history is the best thing. Tell us what's going on. And some people kind of lie. They think, well, maybe they're going to get in trouble if it's something. And so please just tell us what's going on. Because occasionally I've had dogs this was before the days where it's more legal, but in the past, dogs have gotten into marijuana or got into the brownies or something that they shouldn't have.
So bring a sample to test.
Or just tell us that it got into the marijuana.
Yeah.
Often we're suspicious because suddenly this young dog is now all of a sudden really wobbly. It's disoriented.
Yeah.
It's less likely a disease or illness. And so just tell me. I mean, the dog's not going to die from it, unless it's super high, which is rare, getting too much of it. But it's just nice.
But
we can provide closure, treat the pet accordingly if you're honest.
You don't have to chase around to find out it was just marijuana or something silly.
So just try to be as honest and accurate as you possibly can.
Okay. Yeah. The reason why I asked that is because generally if there's a visit to the ER for humans, like for example, we gotta go the labor. My wife's in labor. There's a go bag that you would bring with you, or bring an extra set of clothes.
Yep.
Well, obviously there's no clothes that you need to bring for pets. So so just history and then things that may have caused the problem. Bring that with you as well.
I mean, let's say if it's a poisoning or toxicity, I need some evidence. In animals, we don't have all kinds of tests to check to see if it got into some kind of rat poison or chocolate. We need some evidence of what's going on. I think for humans, there's all kinds of toxicology tests and everything, and we just don't have that.
Yeah.
And so to help us, if
you
we
can
feel
lower
like
that
it's a poison,
down,
you
can lower that down a little bit if you.
We need to really get into an accurate history on poison.
Okay.
So.
Okay. Then is there any stories or any symptoms that the patient has given you that turns out was incorrect and it was something totally different?
Well, the one that comes to mind is that cats are prone to urinary issues. It's another one of these we don't understand,
but they will develop little crystals or sand in their bladder, and it's usually not a problem for the female because the urethra, the outside from the bladder, is much wider, like with people, but with the male cat, the penis, it's so narrow that if they get enough sand or debris in there, they'll get blocked where they can't urinate. And I have had many a pet owner come in thinking their male cat is constipated, because they can't often, often a blocked urinary cat or even a constipated cat, they're often going to go in and out of the litter box, and maybe people notice that.
Yeah.
And often the cat will position themselves differently if they have a bowel movement versus urinating. But in many cases, the misnomer is, oh, my cat's constipated, can you give me a laxative? Well, in 48 hours after a male cat's been blocked with urine, it will die if there's not any intervention. So, and usually when they come in for an exam, I will check right away. And if I feel a large bladder, it's urinary. But that's a common misnomer, that cats are more constipated than urinary. And I'm more worried about the urinary
part
with the cats.
Gotcha.
Though they may have the same presentation.
Yeah. Is there anything with dogs?
I think dogs are more notorious getting into things, so it's not having a good history.
Okay.
What did the pet get into? Do we need to take an x-ray? Is there a foreign body or something like that?
Yeah.
And a lot of times, people can't watch the dogs every second, but probably not knowing if the dog got into anything.
Especially if those little small chew toys that...
Exactly.
Gotcha. Yeah, I've seen videos that are showing, like, it doesn't seem like there's anything wrong with it, and then you hear some weird noise, and then they turn off the light, and then the pet's glowing.
Right.
Because
right.
there's a dancing ball inside.
Right.
That they swallowed. Okay. Let's talk a little bit briefly about pet insurance.
Love it.
When
Yep,
to
that's
get
a great
it.
Topic.
When to get it. How often should you utilize it?
We don't have an hour and a half. I'm teasing, but I'm a real passion. This is another one of my passions. Thank you for this. Veterinary costs have just radically changed. We're trying to keep up, and especially the referral clinics. The University of Missouri at Columbia has a vet school. They have the CAT scans, the MRIs, and we even have an X-ray machine that's digital run. And in the past, we would have to develop x-rays. When I first started practicing, we'd have to put the x-ray film in the developer and the fixer.
Yeah.
And now we take an x-ray, 3 seconds later, we have a completely beautiful x-ray film digitally produced. Well, on average, a machine will cost us $60,000.
Oh, my.
And then, of course, for doing the film, the expertise and reading the films and all that. But anyway, the bottom line is costs are extraordinarily high, even with animals anymore, because of the ability we have for so many diagnostic testing. And the emergency clinics where I worked previously, we had somebody there all the time. We had a 24/7, not seeing clients, but taking care of pets. So I could keep somebody overnight to watch the surgeries, take care of the emergency cases, and that was really a nice thing to have. But that really adds up.
Yeah, I bet.
So most people don't have money for a rainy day, let alone for emergency with their pet.
So you would say then, say if it's like a newborn, it's oftentimes a good idea to get insurance is the next thing before your first visit.
I know you don't think a young animal is going to get into trouble, but we see a lot of bone problems with young dogs, and some cats see a lot of foreign bodies, as we just talked about, that young animals get into. There is parvo, a virus. We see it less likely now, but there are certain viral diseases that dogs can get, and cats, that have to be hospitalized and cause a lot of money. So I know you think your young animal is never going to get into trouble or have a problem, but, and of course it's cheaper. It's like people, your premiums are much cheaper than mine are, just because I'm going to have more likely having medical issues or surgery. And so it's cheaper to start your dog young with the premiums.
Okay. Is there insurance? So like for me, I'd rather just not have to worry about any expenses. So there like all-inclusive care for
There
insurance?
is, but my 2 cents or 1.5 cents worth, I think most people can pay for routine care in the first year or two of life of the animal. And I'm talking vaccinations, prevention,
Yeah.
spay or neuter, that type of thing.
Okay.
But, and so I'm adamant on getting insurance for at least emergency cases
Okay.
or hospitalization cases. But some people like yourself, they want it to cover everything, dentistries, routine care,
Yeah.
and I'm actually good with that as well. But the premiums are going to be much higher
Gotcha.
with the all-inclusive type
Sure.
thing. And so my feeling is that if you can pay for the routine stuff, maybe you don't need insurance
Okay.
for that. But if you have that blocked urinary cat, you had that dog that had a twisted stomach, needs surgery, I mean, you're talking $3,000 to $5,000 or more.
Yeah.
And I mean, it really adds up.
And it can happen
And that's when the
anytime.
insurance, to me, is really handy.
Okay. Okay. So get it and get it quick.
Yep. Yep.
And you don't have to, if you want peace of mind, get the all-inclusive package, whatever. Check all the
It is.
boxes.
And most insurance at this point will not cover, let's say, if your dog suffered a knee injury, we see a lot of tear ligaments, ACL tears and ligaments like people. And if the dog has already had a tear and you don't have insurance, the insurance is not going to cover it.
Oof.
If you need surgery or
Yeah.
something like that.
Yeah.
So again, you get it younger, you don't have to worry about something that may happen that's not going to be covered.
I want to touch up on maybe a case study that you have maybe recently. Do you have any of your patients come in and it was a significant amount of cost to operate or to have?
I remember one that it was $5,000 and the insurance paid 80%
Okay.
of it.
Oh, wow.
And now I think because of computers being more sophisticated, I think now when you check out and pay the bill, the insurance company will pay the veterinary hospital right then.
Okay.
In the past, you would put it on a credit card and 30 days later, then
The full amount is due.
you would be reimbursed. It took longer to do,
Gotcha.
but they know a lot of people, maybe don't have a credit card, or even on their credit card, they can't put $5,000
so it's
on it.
catching up to.
So they're doing better where they can almost instantly pay you or
Yeah.
pay us, so you don't have to
So
pay
you
the
get that
full
discounted.
bill. So
Okay.
to me, it's getting better and better at all times, but people just really have no conception on what the costs are for emergencies.
Is is pet insurance different or the same kind of like medical insurance for humans, like vision and oral is a separate insurance policy?
If it's emergency, which a lot of those are, it will cover it. And I want to make it clear that I forget the name of it, but the insurance for animals is between the pet owner and the company.
Okay.
The doctor is not involved at all.
Gotcha.
We have no say.
Yeah.
The pet insurance says, well, the average knee surgery costs this much money. That's what we're going to reimburse you for. They don't
It's
go
not
by
based
what
off
we
of
charge
what
or the
you-
other doctor down the road charges. So there's only two parties that are involved. So the pet owners do not have to fill out all the insurance claims.
Yeah.
We send everything in, the veterinary hospital, what was done, what was the diagnosis. So to me, it's much simpler, not only financially, but a lot easier to keep your records and all the paperwork that humans have to do if you have a lot of medical issues going on. So I
Is
think
it-
that's pretty neat too.
Are the procedures pretty standardized in terms of
Yes.
of cost and
Yep.
all that? Oh, okay.
It is.
Okay. So there's no chances of like fluffing up the numbers or anything like that.
No. No.
Okay.
No, I think it's
That's
a
good to
great
know.
deal all around. Yes,
Yeah.
nothing's perfect, but I just think it's the
Yeah.
best way. They do have some credit card deals where, like, the credit cards, and they have them for people for health that, for 6 months you don't have to pay anything on your bill. The credit card company
Okay.
will charge us a little bit more, so
Some
they
type
get
of
some
promotion.
money back,
Yeah.
but it will hold off, and so you can pay a little bit at a time. So that's another option, which a lot of people have done.
Okay. So then, I mean, just like humans, health insurance, it's good to have pet insurance.
It is.
And the earlier the better, right?
Yes.
And then is there any? Do you have any recent case studies that you want to touch up on, just in regards to kind of like a situation where it was a very good thing that they had brought their pet in versus because they were debating on not to bring it in?
Calvin, it's very difficult because maybe 5% of pet owners in the States have pet insurance.
Mm.
So it's not something, unfortunately, we see a lot.
Yeah. Okay.
And in many of them that I remember were more for routine stuff, which is good for the pet owner. But
Sure.
I'll do a little research, but I don't have a good answer because it's fairly infrequent where a large, serious emergency case,
Gotcha.
that the pet owner is compensated
Yeah.
for.
Okay. Okay. Then let's move on a little bit to if you have any current cases that you're working on that you would like to share.
Well, this is a one, it's kind of another one of a dilemma, but a dog had seen one of the other doctors and the pet was just off. In this case, the pet owners, the pet wasn't eating very well. It was just kind of lethargic, but it wasn't vomiting, diarrhea, coughing, sneezing. It just wasn't doing well. It wasn't because of the lack of good history. And it turned out the liver enzymes were very elevated. And whether human or animal, many times when we look at blood tests, like example, if the blood work shows elevated liver enzymes, it means that the liver has been diseased or traumatized, and it releases these enzymes because of that into the bloodstream. So I always found that this is kind of neat that we don't have to do initially all kinds of tests in the liver. If we see that the enzymes are elevated, that's probably the problem, the liver in this particular case.
Mm-hmm.
Well, the dilemma is the test doesn't tell us, is it an infection? Does the dog have cancer? Is there some blood vessel abnormality? And that's where it gets kind of frustrating. Well, in this case, the doctor decided, let's go ahead. There are some good liver supplements that gives the chance the liver to heal whatever, even though we don't know exactly what's going on.
Okay. Is there?
And so initially, these people, they found out I was there at Carter, and I had known them when I worked in St. Charles, so I've known them for 30 years. And so they wanted me to continue the care. And so we ran some other blood tests recently, and 2 days ago we did an ultrasound, but this is where a person comes in just to take the ultrasound. They send it to a radiologist, and I haven't gotten the results back. But often for liver disease, to get a definitive answer, sometimes you have to take a sample of the liver or get more detail of it. And so I'm waiting for the results on that.
Gotcha. Okay. Would this be a case where the pet would stay at the hospital?
Sometimes we do, but in this case, no. We do have appetite stimulants, and the good thing was that after a couple days, the pet gave the appetite stimulant to the pet. It started eating a little bit better. And now it's been about 2 weeks. The pet was given these liver supplements, and it's actually doing better. So it may be one of those, it does fine eventually, just with the supplements, or the liver just kind of took care of itself.
Okay.
Whatever was going on.
Just to help them going on.
But it was never bad enough in this case to be hospitalized. It never became dehydrated. We didn't have an indication at the time to give any kind of antibiotics. So
Okay. So
everything's been done at home.
done at home.
Yep.
Okay. So it wasn't as critical
That's correct.
as it would played out to be. Gotcha.
If a pet comes in and it's laying on its side and we see it's severely dehydrated, constant vomiting, which sometimes liver disease can cause, not in this case,
Yeah.
then, those pets have to be hospitalized.
Okay. Is it pretty often that you guys have to keep the pet overnight or for extended stays? Or is it
Where
kinda
I
like
worked
one and done?
before, we probably had an average of 2 pets every night that were hospitalized.
Okay. And at
we
that
each
point,
see 20 cases a day. So, where I was before, maybe we saw 100 cases a day. 2 cases would be hospitalized because it was severe enough.
Yeah. Okay. Gotcha.
So I don't know if it's
So
answering. So
yeah, it does.
it's a fair small minority.
Yeah.
And where I work at Carter right now, we close at 6 o'clock each night, and they do not have an overnight person. So if it is bad enough, we will send it to one of the emergency clinics,
Gotcha.
and they'll do the
Okay.
carry service overnight or continue for the next couple of days, depending how long the pet needs some kind of
Okay.
support.
Do you guys typically work with shelters, or is it majority pet
We
owners?
do, and in the past, I have worked with some of the local animal shelters that we would provide a smaller price or a unique price to spay and neuter the pets at the
Yeah.
shelters. Or if they sometimes need health care, we would cut corners and provide a discount of some sort. So
Okay.
yes, we
So
did
pretty
help
involved in
some
that.
of them in those cases.
Gotcha. Okay. Because um, I did, went to a gala recently, and it was for Care STL,
Hmm.
and they had their spring gala, and it may not be pet emergency related, but I noticed, they had a puppy pen and a kitten pen set up, all for charity and whatnot, and they were just encouraging people to kind of hold the pets and give them some love, and hopefully to kind of get them interested in adopting. Um, but I couldn't help but think it on the surface and everything, it all looks great because pets are getting their love and
Yep.
the attention that they need. But I just can't help but think would it be a little overwhelming for the puppies and kittens that if there's, a crowd of, say, I think it was like at least 500 people there in attendance, would that be
I think for some of them, yes, some would love all that attention. Again, it just kind of depends on the personality.
Mm-hmm.
But I would hope that if there's a dog that's very nervous or maybe was not socialized very well when it was younger and doesn't know what to do around people,
Yeah.
that they would have more of a private showing that, come to
Gotcha.
our animal shelter. We got this cute dog. You can give them a picture and show them, what a cute dog it is.
Yeah.
But to have people, surrounding it, I would not be appropriate. But I can tell you that we work with the pet store at Carter, and so many people, they hang on, touch the pet, the pet is theirs. It's amazing how much just a little bit of direct contact with the pet.
And that's all it takes.
I've got a lot of pets, because my cynicism was they bring a lot of the pets there because a lot of the pets are going to be bought or purchased or sold
Okay.
at that gala.
Yeah.
Because most people can't oh my gosh, this cute little thing.
Yeah.
I think we're going to take it home. And that's one
It's
of
on
the
an
bad things
emotional
you
level. They can't help it but to bring 'em
exactly,
home.
exactly.
Yeah.
I mean, I wish they wouldn't do it because sometimes it may not be appropriate that, the kids are too young to interact with the pet appropriately,
Mm-hmm.
or the pet, I always smile. A lady comes in with 4 little kids and they just brought in a new little puppy for me to see. And I'm thinking, oh my gosh, this is quite a responsibility. I wish you had kind of thought twice.
Yeah.
I know they want it for the kids and all that, but that's, again, an
You may
example. It's
think
probably
it's like
not
an
appropriate.
impulse.
The pet's
Yeah.
not going to get enough attention because once all the school activities are going on, may not get the best of care, health care, only because you only have so much money and, the kids are the priority, that type of thing. But
Okay. Yeah, I mean, I believe they mentioned too is that they hand selected certain pets to be brought
Yep.
into the pen. So I'm
most likely
pretty
they
sure
did.
that
Usually
they've-
that's appropriate. Most puppies, and a lot of times it's nice, let the puppy come to you or even the cat or kitten. But a lot of times, oh my God, I love this cute little thing. And people are trying to grab, or let's say they reach over the corralled area and, just open the area up and let the puppy kind of check people out
Yeah.
a little bit.
Well, I was taking photos for that event, and there was one moment where it touched my heart because I just saw this older lady was carrying this puppy and holding him around, and the puppy just wouldn't stop licking her, and she was just, it looked like her life was just lit up.
Yep.
And I captured that moment, and it was like, oh my gosh, I'm sure she's been, but it looks like she was having the time of her life.
Yep.
It was the happiest that she's been.
Calvin, I don't want to
So
give anybody a bad impression. For the vast majority of cases, it's a win-win for the animal
Yeah.
and a win-win for the family. But sometimes you do have to do a little thinking. And I
little
just get a
reality
little
check.
nervous when you just see that cute thing and decide you're just going to take it.
Yeah.
And many times, like at the pet store, I mean, it's a good chunk of change. It's not
Yeah.
like $1.55 to get this animal. And then, most dogs will live 10 to 12, 14 years. That's a long time to take care of an animal, be
Yeah.
responsible, feed it, let alone the health care.
And also not long enough time to be
Well, that's true.
at the end, because for me, like, I've had a period probably like 10 years ago. I've had a period in the year where I was looking at pets and adoptions and all that stuff, and I just look, not even being there, but looking at pictures and all that stuff is like, oh my gosh, I just have to have them, you
Yep.
know.
Yep.
And thankfully, I'm a more uh, I've been better at it, but I've been more realistic
Yep.
type of thinking, and I'm like, I have no place in my life right now to be taking care
Yep.
of this huge responsibility. As much as I do, I'm pretty sure that I will, devote my life to taking care of them, but like, it's just not not feasible at that moment
Yep.
in life. So, yeah, like I'm delaying the gratification of one day when I get that one puppy that, love at first sight type of
Yep.
thing, because they say love at first sight is not
Yep.
real, but until you look, until you have the right puppy or right cat come up to you, that'll change your world.
Indeed.
Yeah.
You're exactly right.
Okay. So let's move on to some questions that I
Okay.
have gathered on the internet. Someone asked, and this is a mix of different platforms because we're still fairly new to the podcast or into the episodes of this podcast, and if you guys are listening and have any general questions about pets in general, whether you're thinking about having one and you have a few questions that you want answered, go ahead and leave a comment down below or email us at the email address provided in the description. If you have anything that's more pressing or you think is more critical, obviously don't wait for us to answer it.
Right.
Call the local vet.
Yep. Call your veterinarian if you have one.
Yeah.
Or
But
call an animal hospital and get some
Yeah.
information.
So, but if you have general questions, curiosities, and whatnot, we would love to answer those for you. Be as thorough as you can, but don't send us a published novel. But be as concise and give us as much detail as you can. So the first question is, and this is just surface level questions for you, is my dog just ate a grape. Is it ER time or can I wait?
It's interesting. I forgot about that, but we had a case come in yesterday, and the dog got hold of 5 grapes. They were good enough to bring the pet in. We made the pet vomit, but only 1 grape came up. This is a relatively new thing. I think maybe we're getting closer. We don't know exactly what is in the grape to cause, but with dogs and some cats, not all dogs too, this is what makes it more challenging, it will cause kidney disease or failure. It affects the kidney.
Okay.
That's what the grape will do.
Oh, wow. Is it like...
And it doesn't take many. Thank you, guys and gals. Thank you. Thank you.
They want grapes.
Yes, and they do get grapes. They don't have a problem with it.
Okay.
Yeah.
Okay.
So, I'm sorry, Kelvin, but if we say grapes again, we're going to have to spell it because I think they know what we're saying.
They know it by now. Okay, I got you.
But it's a very difficult, in most cases, I just, like yesterday, we didn't get all the grapes vomited up. So I said to the lady, if it's going to cause a problem, and there is a good chance, I don't know a statistic, but there's a good chance it won't have any problem at all. But if the pet stops eating, starts vomiting, that could indicate kidney issues. I mean, if it continues to eat, run around, it's probably not going to have a problem.
Okay.
Though we can run a blood test a day or two after the grape is ingested, eaten, that we could run a kidney test and find out.
Okay.
But again, the long answer to this, I would probably just monitor the pet closely.
Yeah.
And just see if it's showing any signs of illness in general.
Yeah. Okay. So I only know of chocolate and grapes that are bad for pets. Are there any other foods that people are wondering and might not
I've not
know?
really had much of a problem. To answer your good question, onions can be a problem, but I think most dogs, and especially cats, they get one little taste of an onion. I don't think they would eat it significant enough.
Yeah.
But what will happen is that if you eat enough onion, it will damage the red blood cells, and the pet will become anemic if they eat enough of it.
Gotcha.
So onions are toxic, but I'd say in general, a pet's probably not going to eat enough of it. But I would certainly not offer food to it.
Well,
onions, like, your
I don't think that's like a
has,
treat that people would generally offer, even to themselves.
Yep.
So, okay, so no, for sure, no chocolates, no grapes, and watch out for onions.
If you're, this is probably very infrequent. If you're making bread, I've had some dogs will eat the yeast, and then the air in their stomach, the bread will start to develop or grow in their stomach.
Oh.
And so we've had to go in and remove the yeast
Yeah.
for the bread. So
What problems would that cause if they don't notice it or nothing's
well,
wrong?
eventually the dog may start vomiting or just
Okay.
it would
just
the
vomiting.
stomach, even though it's kind of under the ribs, it may become distended enough that, oh my gosh,
Okay.
my dog has a distended belly.
Yeah.
So the pet may order
So they'll pick up on
another.
that.
And again, that's pretty infrequent, but you know things you wouldn't, you know, maybe palatable to the dog,
Mm-hmm.
just smelling the bread and then
Mm-hmm.
getting close to it. So you have to be a little bit careful if you're
Okay.
baking bread.
Okay.
So bread's another issue, and I'm kind of going blank. I'm sure there's a few others. I think avocados are toxic, but I'm not sure I've ever seen a dog come in
Gotcha.
that
Okay.
developed clinical signs.
Okay. 'Cause avocado's pretty popular food and breakfast.
Right.
For healthy
Right.
people, healthy conscious
So again,
people.
some of us just have that. We have to feed something to the dog because it's right under the kitchen
Yeah,
table. I
yeah.
can't stop not giving something. Just don't give the avocado.
Okay. So would it be safe to say that just if you're unsure, just avoid
Of course.
majority of
Of course.
vegetables, but like red meats is okay?
Well, we think a lot of dogs develop another condition called pancreatitis. I won't go in much detail, but if they get into the trash or eat fatty foods, it can cause a pretty serious
Oh, really?
illness, the
Okay.
pancreatitis.
Okay.
I think in general, the pets should not get table food at all.
Okay. So in the case of what doesn't kill you makes you stronger doesn't apply to pets really.
Yeah, I agree. I
Okay.
would say, and again, real quick on the table food,
Yeah.
I mean, if you want to give your pet a couple green beans, excellent, especially for an overweight dog, instead of giving the potato chips or the pizza, give the green beans, or green peppers, strawberries, blueberries in small amounts. Most animals just love that. So that's a good table.
Okay.
But I'm, talking most of the crazy food that most of us humans
Yeah.
eat, especially when you're laying on the couch watching television
Yep.
and that type of thing.
Yep.
So,
Okay. So would they take it as treats? Because obviously children, they hate vegetables, so they know those aren't treats. But
yes.
pets would take it as treats. Okay.
that's where it becomes a problem. I mean, you can tell your child that that's not for your dog. But
Yeah. Yeah. Okay.
my sister didn't like peas. She would knock the peas off the table,
Mm-hmm.
and the dog was right there, and the dog liked the peas.
Okay.
So it's kind of hard to talk. But
Yeah. Is that also a no-no word, peas?
probably peas are too.
Peacocks.
They do like vegetables. They're omnivores, peacocks.
Uh-huh.
They like both meat and
Yeah.
vegetation.
Okay.
So they get quite a wide range of cat food and hot dogs and
So we just have to
vegetables
watch
and all that. So maybe we just have to start spelling
spell
everything.
every food.
Or
Yeah.
next time before our next podcast, I'll put some earmuffs or something
Yeah,
on
yeah,
there.
yeah. Okay. Speaking on chocolate, is it just any amount of chocolate you gotta take the pet into the
It's
hospital?
the dark
or-
chocolate. The components are called theobromine and caffeine, which people are familiar with,
Mhm.
but that's what causes the problems in the dog.
Gotcha.
Dark chocolate, baking chocolate is extremely high in those ingredients.
Okay.
A couple squares of milk chocolate, a couple M&Ms, no big
No
deal.
big deal. Okay.
And it depends on the size of the animal. If you're got that little Yorkie or Pomeranian,
Yeah.
it's going to,
It's different
of course,
from
less
an M&M versus. Yeah,
Right.
Gotcha.
You
Okay.
got that big Great Dane, you could probably take more chocolate and not be a
Yeah.
problem.
Then another question from the audience or from the internet is, my cat hasn't eaten in 36 hours. Is that a crisis?
It is a crisis. If cats don't eat within a couple days, they develop what we call fatty liver. They actually get fatty deposits on their liver, and then we're really in hot water. So if cats will not, you can offer a little bit of tuna fish, warm up some canned cat food, and if it turns that down, you don't want to mess around with a cat. A dog, you don't want to go a week, but a dog could easily go a week without not eating
Mm-hmm.
and still get things turned around.
Okay.
But cats are very peculiar creatures, and with not eating in a cat, you want to be very aggressive.
Okay. Another question is to touch up on vet care and costs and all that is, what if I can't afford vet care right now? What can I do?
Well, my cynicism is you should have had that pet insurance before. Yeah. I just think most humans in the States anyway, they just don't have the thinking to put some money aside. Or maybe they do, and all of a sudden the car needs 4 tires.
Mm-hmm.
And so then they pay for that.
Mm-hmm.
I know in the olden days, for Christmas presents, people would put money aside or give to the retail stores some money. So each month, so they would have enough at Christmas time, to pay for it. But people just don't have that mentality to do it. Most time, people put it on a credit card. I mean, that's the best thing.
Quickest and easiest.
We used to be much more generous, but people really took advantage. Well, we'll let it go. Why don't you come in once a month, give us a check at the time when checks were more a way of passing money.
Yeah.
And we spent way too much time tracking people down to get it. They just think because we love animals, they don't realize it's a business. But because we love animals, they really don't have to pay.
Mm-hmm.
Many pet owners have a different mentality with their pets, and our association with them, that we just pet the animals. We give them shots, but it's a business.
It's a business.
So
at the end of the day,
Again, credit card, these 6-month debit cards, pet insurance. You just have to be prepared. If your luck is like mine, you're all prepared and nothing happens. Well, that's a good thing. People think if they had pet insurance, well, what if I don't use the pet insurance? Well, to me, that's a good thing. Mm-hmm. The pet insurance isn't used to make money. It's to save for a rainy day, like car insurance, home insurance, that type of thing. It's just another insurance thing.
Yeah, very insightful.
Not an easy answer, because I think most veterinarians,
tough lesson,
either you have the money or we're not going to provide this service.
Yeah, because it's as much as there is love and an emotion into it, you still have to be responsible. Gotcha. And
I had one. I remember a story. I had a dog that had come in for some skin problems, and it got a lot better, and the people were very happy with me, and we kind of set a bond. Well, 2 weeks later, after the last visit, they brought the dog in. It was maybe 4 or 5 months old.
Mm-hmm.
The dog was limp. It was alive, but it was limp. And it turned out it had parvo. Well, I just couldn't eat. If it's laying on its side, giving it a pill is not going to turn things around. There was no easy way.
Yeah.
And unfortunately, they had made it clear before they didn't have much money when I'd seen it for these other things. And I thought, well, I just can't say no. And we kept the dog for 5 days, and it's doing fine. And I said, I called him, I mailed him. I don't know if I texted him. Maybe it was kind of before more. We had the texting. But I told him, I went out on a limb to help save your dog, and I expect some payments. You don't have to pay it all at the same time. Mm-hmm. And, I never got hold of the people.
That's tough.
So I know people say, well, we just don't care about animals, but that's not the case. Mm-hmm. And, you just have, unfortunately, there's a few bad apples, promise to pay, and they don't. Mm-hmm. You just say enough is enough.
To ruin it. Yeah.
I don't care how good you are. I can't tell until you owe the money, and then it's too late to find out if you care or not.
Okay. Then we'll move on to our segment where you had a list of
yes.
What was it? 10 common mistakes.
I have 10 common mistakes that you may be making as a pet owner.
Okay, so we'll go through them all.
How much time do we have left?
We can go through all 10 of them, and then
it's going to take a whole period of time, but I'll just I'll just mention them.
We'll talk a little bit briefly about each one.
You got it. Yeah. You got it. The most common mistake is that pets are overweight. Mm-hmm. Just like people, they say, 60% of Americans are overweight. And when you see your pet every day, we kind of talked about it before, you just don't realize when they put on more weight, or maybe a member of the family doesn't mention that they give extra snacks every night.
Yeah.
And, when you have a 20-pound dog, if you give him 20 potato chips, which the dog will eat, that's a significant amount of calories for a small dog. People don't understand that if I can eat 20 potato chips, it's not that bad for my dog.
Yeah.
Well, it just doesn't work out that well.
You're essentially stuffing a piñata.
Exactly. And then when they come in 2 years later, a common cause of torn knee ligaments is being overweight because there's too much weight. the dog steps in a hole, there's too much weight on that knee, and the people get upset, oh my God, I got to do surgery on my knee. Well, it's your fault because I don't say anything.
Yeah.
What good would it do?
Mm-hmm.
But because of the obesity, you may have developed this injury. More diabetic animals are because they're overweight as well. So there's a lot of medical issues that can be caused by being obese, let alone that the pet is uncomfortable.
Yeah. Okay. First one was
just being obese or overweight. And again,
and the common mistake was that pet owners think that their pets are overweight. Okay.
Most of the time they do not realize that they're overweight.
Oh, that they don't realize that they're overweight.
Right.
Gotcha. Okay. Okay.
And on the podcast, maybe it's a little hard to explain, but a perfectly normal weight cat and dog, if the dog is on all 4 feet and you look down on the pet, the waist should actually be an hourglass. It should be a figure.
Shape.
You should have the hourglass shape. If you touch the ribs or the side of the dog, just touching the skin, you should feel the ribs. You shouldn't have to push in.
Because that's all the fatty.
Exactly.
Okay. Gotcha.
And the final thing is, and it's a little bit more subjective, if you look at the side of the animal and you see the abdomen, it should be kind of tucked up, right? Again, where the penis is, or the back part of the abdomen should be tucked up. It shouldn't be the same covering the whole belly area.
Okay. And this is all for educational purposes.
This is for, right.
So we're using scientific and technical terms, right?
But the problem is when you do see your pet every day, because you made the comment, and if you have somebody comes, maybe they hadn't seen the pets for a while, they may have a good idea.
Yeah.
Is that the? Yeah, I think we're okay. Just you may have to kind of push a little bit there.
They're like, it's late. It's getting late.
So time for their bedtime.
Yeah.
Usually I put them in the chicken house at night, so maybe they're waiting to go to the chicken house right now.
Gotcha. Okay. So yeah, let's number 2.
So number 2, neglecting dental health. When people say my dog has doggy breath, that means the teeth need to be cleaned.
Doggy breath.
And usually that involves a dentistry. Just like people, we clean and scale the teeth. We do many more extractions. We do less root canals. There are some veterinary dentists that do that, but most people don't want to pay that. But there's a lot. Dogs and cats generally don't get cavities. They get just went blank. It's more infection. The roots get infected.
Gotcha.
So periodontal disease is the main issue. They do not have to worry about the cavities for the most part.
What would you say about goose breath?
Goose breath, I never get close enough. They really don't have teeth, so they don't. This part they can ignore. So maybe if they would walk away, it would be all right.
Yeah.
So anyway, if your dog has bad breath, it's time to get in and see the doctor. It's not an emergency, but within the next couple weeks, you need to see somebody and take a look.
Okay.
And sometimes they can suggest an infected tooth. I'm just going to see if I can just kind of push them off here.
Push them away.
Because I don't want you getting the back. Okay, let's go. Come on, let's go. Let's go. Yeah, whatever. So let's try again here.
Sure thing.
So number three is picking the wrong pet. We've kind of talked about that.
Yep.
But if I have an older couple, 70 years of age, they may not want to get a German Shepherd or something that's very active, or a Labrador Retriever. Yeah. They may want to get that little cute Pomeranian or Yorkshire Terrier. Exactly. Gotcha. Exactly.
Okay.
Or if you're somebody that's busy all the time, if you get like a Lab or Golden Retriever, they require a lot of attention environmental wise. You got to take them for walks, take them to the park. You can't let them sit in the house all day and not eventually develop some separation anxiety or destruction in the house, only because they're just not getting enough attention.
Yeah.
So you need to look up the breed. I've had a couple of couples that come in recent months, and they were trying to get down. They picked 4 or 5 breeds. They did a lot of research, and I was really tickled what they decided eventually, that they took the time and not just go to the pet store and pick one that may not be appropriate. But I feel like we see a lot of inappropriate animals for the type of people that are deciding to get it.
Okay. So I have one quick question in regards
I got
to
plenty
that.
Time.
If I was someone that is not generally home.
Yep.
Maybe excluding the sleep, maybe at most I'm at home 3-4 hours of the day. You wouldn't recommend that
I
person
would
to get
recommend
a
a
pet
cat.
or a cat.
Now, my older age, maybe because I'm getting lazier, but cats are much easier. You don't have to take the cat outside to potty.
Yeah.
They use litter box very well, and you have feeding timers that the cat could be fed
Auto
periodically,
feeders, yeah. Okay.
so you don't have to be around. But
Okay.
they require less care. But if you want an animal, and again, I love pocket pets, the ferrets, the rats, mice,
Yeah.
and all that, and they may be good pets to have if you're kind of into that, because again, they don't require attention to be taken outside or
Sure.
quite as much social enrichment of the
Yeah.
environment and all that.
Yeah. Okay. Got it. Cool. Let's move on.
And number 4, your pet is not getting any socialization or training. Most people feel with their pet, I'm just go ahead and give it whatever it wants. And I think right away you need to discipline your pet. And maybe before, like, the dog goes outside to potty or goes out to play, when they at least come back in, or you make them sit before they go outside, or before you feed them, they need to sit, but they need to earn things instead of just putting the bowl of food on the ground.
Yeah. Okay.
And most pets, dogs especially from 7 to 14 weeks of age, is the very critical socialization.
Yeah.
And so this is, if you're getting a puppy, that it's critical to be around other people. People have a misconception, well, I'll wait till they get all their vaccinations. Well, then it's too late, because usually the last vaccines are at 16 weeks of age.
Okay.
But you have to get your pet socialized, and I highly recommend getting training. And of course, the training's for the person, not, don't tell anybody, but it's for the
Don't
pet
just leave
owner.
the dog at the training camp. Yeah, you can be there with the dog.
Yes.
Yeah.
So I need to keep in mind, it's more than just feeding the animal and taking it for a walk.
Yeah.
You need to look into getting some kind of training going on.
Okay.
And a lot of times it happens where a dog gets lost, especially, and so you want to make sure you have a microchip, or now they have video cameras on your phone and that type of thing. But
that's right.
you need to be prepared in the event you may lose your pet,
Okay.
because it's pretty
Common.
drastic. People are pretty upset about that.
Yeah.
So
I see a lot of missing dog signs in the neighborhood.
Yep. And I know it's expensive, but both for cats and dogs, they need prevention. Cats can get heartworms through mosquito bite much less than dogs, but we see it all kinds of flea and ticks, and it's easier to prevent. Once a month, you give a pill to your pet. Cats, there are topical treatments, and it prevents most intestinal worms, heartworms, and now they pretty much have one medication that does it all. Before, you'd have to give something for that fleas, something for ticks, but now they have something for everything.
Okay.
Why have your pet come in? It gets a tick disease, or it gets so many fleas that it becomes anemic. I've seen that quite often. And heartworms, it's treatable, but it's very expensive, and the dogs can die from heartworms. So please stick with the prevention. Some people say, well, I'll give it in the spring. Well, spring to them means July. Well, mosquitoes are already out. You just have to do it year-round. You're in the habit of giving it. I know this past January and February, it was perfectly cold, frigid. There are not too many parasites around, but we procrastinate, and we'll start a little bit later, and then, like
Next
I said,
thing
it's
you know,
July.
it's already the summer.
So keep up with the prevention.
And that was number 5?
That was number 5 or 6. Did I miss something? I put 6 on there.
Okay.
The other, number 7 is foregoing nail, ear, and skin care. It's important to trim the dog's nails, especially long-haired animals. You don't see the nail, and I bet once a week I have a nail, especially on the thumb. It has grown so much it's grown into the pad below. And the animals don't complain unless they're really licking at it or start limping. People just don't notice it.
Yeah.
But you need to get groomed or do it yourself. You need to brush the pets out. Especially in the summer, the double coat dogs, you got to brush out all that inner coat, and most people don't do it. And then they say, well, why is my pet shedding? Why is it overheating? And it's because you didn't get that undercoat brushed out.
Yeah.
So there's a lot of grooming, attire you need to do for your pet for well care.
Okay. So for cats, I hear it's unethical to remove the claws. Is that true?
We may want to save that for another session.
Oh, that's enough.
Only because it's got my brief comment is that it's gotten out of hand and emotional. I have had cats as pets that have been declawed, and people are saying, well, it causes all kinds of emotional distress, and I just don't agree with that.
Okay. Trim
There's
is
just
fine,
a fine
though.
line. Maybe we overdid it, declawing too many cats, but I think there's some cases where it's a good idea to do it, and I just don't think we need to go to the other extent where you just can't say it's not allowed. But in many counties, in St. Louis County, it is illegal, and I think St. Charles County is getting close locally where I'm at of making it a rule where you cannot. It's illegal to do it.
Okay, but trimming is necessary or not necessary?
I would trim, yes, because if you trim the cats or have scratching posts, cats use their nails for marking, to wear the nails down. And if you do intervene, especially as a kid, and get them used to it, once a month, just trim the tips. You don't have to trim the whole nail. Just trim the
sharp end.
tips. Yep.
Yeah, gotcha.
Yep.
Okay.
So we just need to do more for that.
Yeah.
We've already talked about number 8 is failing to budget for the animals.
Yep.
I won't bore people anymore with that.
But it is important.
It is important, yes, as we've kind of given good examples. Number 9 is avoiding the veterinarian. Again, I know it can add up, but if you get with one veterinarian you like, they learn about the animal, you feel comfortable when they make suggestions or recommendations that they're making it for you and your pet, not to get the almighty dollar or something. You're comfortable with them. And again, why not gift the vaccines? I know whether human or animal, vaccines are tricky. And of course, I'm old enough. I just don't understand why people don't get vaccines for their pets and their animal and themselves in many cases. So that's kind of frustrating. So again, preventative care. We're trying to stress. You'll just have a lot less problems if you do that. And this is my other pet peeve, is listening to other people. I'll have to read this paragraph. To other people for medical advice.
Okay.
Everyone seems to have a different opinion on pet care, even Dr. Google. Of course, veterinary medicine is not always black and white. Many veterinarians find groomers, breeders, and trainers will argue against their advice and tell the pet owner something else that in many cases may be wrong. Yes, admittedly, everybody is passionate on their advice, but often wrong advice. From the teenager, the pet store employee, the eccentric neighbor with 20 cats, your friend, and so on. People who have minimal medical knowledge or training. I don't have all the answers, but after 8 years of school and 44 years of experience in seminars, I have seen a thing or two. If I don't have the right answer, I'll find somebody that will. But the last part here, your lawn guy is not going to perform a colonoscopy. Your hairdresser is not going to agree to take tumors off people or animals. So why should this be any different?
Yeah.
And then as I wrote in this note, I feel so much better. So thank you for listening.
Yeah.
But ask your veterinarian for advice and not, a local person. Maybe they do have good advice, but to me, in many cases, it's either wrong or it just makes the issues worse. So talk to the doctor.
And you would say it's kind of like finding the right therapist. Not every therapist is right for you, but
that's exactly
same thing
right.
with vets.
Exactly right.
Okay, find the right vet. And
So those are kind of 10 things that I think people are missing out on. And down the road, if we talk a little bit more on each one, I mean, obesity, I think we need to talk more down the road because it's such a enormous problem, and trying to convince people it's just a challenge all the way around.
Yeah.
Because they always say, well, I just gave one potato chip, it was just one.
and when
and
it's
that's not always
clearly
the case.
what I see, not friends, but I see certain animals walking around, and clearly they're overweight.
Yeah.
But the owner is like, they just try to avoid that subject altogether. So
I did have one pet owner come in one time, I won't forget. He says, I know my pet's overweight. I don't care. I just want my pet happy.
Yeah.
And
spoiling.
I'm glad
them
he
too
told
much.
me ahead of time, and that took care of the lecture or the speech.
Yeah.
Not that the pet's happy being overweight. I mean, they may appear happy, but I don't think an overweight animal is always healthy. But he made it very clear he didn't care, and I appreciated his honesty, and so he did not get any kind of weight seminar or lecture at that point.
Yeah, maybe he's probably gotten enough of that. All right. Well, I think that will do it for us for episode 4 of Language of Pets. Again, thank you, Dr. Lange.
Thanks.
for
It's been
all
fun.
of your knowledge.
And the weather's been
expertise.
good because in a couple days it's supposed to be nasty
Yeah.
outside.
Well, it
So-
almost got to 90 degrees
Yep.
today, but as
But
the sun
wasn't
went down.
right? But I was outside doing some yard chores, and it
Mhm.
wasn't too bad humidity-wise. I
Yeah.
didn't sweat too much, but
Yeah.
I think it's going to get really nasty. The more typical St. Louis weather we have.
Yeah, and as great as it is to be outside, if certain times that we'll have rain, maybe we'll relocate to maybe not in the peacock cage, but maybe in the
Or the
barn
chicken
behind
house,
us.
maybe the barn, maybe,
Yeah, I
or
think
we can
that'll
do
be
the
a good
house.
change
Yes,
of pace.
the house is an option.
Yeah, the house is an option. But I'd like to maybe be a little dynamic in terms of where we film. But
Well, we
as of
had
right now,
Some fellow pets that were very agreeable.
yeah,
The geese
came in
and-
on cue.
Yep.
Yep. That's
Yeah,
awesome.
I like to say I trained them ahead of time, but that would be a little incorrect.
Well, it's movie magic. Well, yeah, as you can see, we've gotten a little bit of upgraded furniture just to make the scene,
Like
the
it.
set a little bit more casual and elevated. But yeah, hoping to be a little bit more dynamic in terms of how this podcast will look. As of right now, it's pretty close to, well, it's a little almost past blue hour.
Yep.
So hopefully the brightness of these cameras will hold up. But when we're having great conversation, it's difficult to stop. So again, give us a like, comment down below of any questions that you have. We don't have any sort of paywall or anything to have our expert, Dr. Lange, here answer any of your questions. So drop them down below. Questions, comments, even email us at the address in the description below. And we'll see you next time. All right.
Excellent.
Thank you, Dr. Lange.
Thanks, Calvin.